Hello, this is Dr. Kevin Kirby. I'd like to talk to you today about some more biomechanics terminology for the modern podiatrist. Today we're going to be talking about moments. Let's go back to our last lecture on force just for review. You remember that force is a linear quantity. It can be described as having four components. So when we look at this illustration I've designed of the right foot hitting the ground at heel contact and running, and we have a ground reaction force vector acting on the posterior lateral heel, which is a linear vector quantity. The four components of that force are going to be its magnitude, its line of action, and here's the line of action, here's the magnitude, the direction going up along this line, and also the point of application here in the posterior lateral heel. So remember, force is a linear vector quantity, having both a direction, a magnitude, a line of action, and a point of application. So when we start talking about movement at the joints of the body, though, we have to start talking about joint rotations, and this is where we need to describe the quantity that we call a moment. So review, force is a linear quantity. So here we have a weight resting on a table. The table is pushing upwards with 80 newtons of force, and the acceleration of gravity on the mass of this object is pulling downward on the table with 80 newtons. So these are linear quantities. But when we start talking about a moment of force, or abbreviated in the international biomechanics community as a moment, or a torque in other fields, this is going to be a rotational force. So to calculate the moment, we first must know the force. So here's the force of this mechanic pulling on this very large wrench across its moment arm or lever arm, which is D, and force times lever arm or moment arm is going to equal the moment, F times D. So the moment arm, it's important to understand, is not going to be just simply always perpendicular to the line of action. Sometimes the force vector is going to be coming sideways, and here shows our sideways arrow, the blue arrow coming in. It's going to be, the force vector is at this still the same point as which the hand is pushing here in the picture, but we have this line D, which is going to be the perpendicular distance. So the moment arm for calculating the magnitude of the moment is going to be determined by the perpendicular distance. Here we have the red line being the perpendicular distance D from the line of action of the force to the axis of rotation. So we just can't assume that it's always going to be the same distance because sometimes forces do act from different angles than directly normal or perpendicular to the lever arm or moment arm of the system that we're studying. So using the equation F equals moment arm, force equals moment arm times magnitude of the force, then any moment is going to be increased if it has a larger force or a longer moment arm. And in the international biomechanics community, moment is measured as Newton meters. In other words, force times moment arm is going to be Newton meters. So let's look a little bit at the ankle joint dorsiflexion moment. Compression force from the hand. Here we have the, let's say this is the foot lying on a table. Here we have the tibia, talus, the rest of the skeleton looking at from lateral, and we're measuring ankle joint dorsiflexion. So let's say we push on the bottom of the foot at the forefoot with our hands with 50 newtons of force. So that gives us our force. The moment arm is measured to be 12 centimeters from the perpendicular distance from that force vector to the axis of rotation of the ankle joint. So that's 0.12 meters, and from that we can calculate the ankle joint dorsiflexion moment being 50 newtons times the 0.12 meters, It's going to be 6 Newton meters of dorsiflexion moment at the ankle joint. So this is a fairly easy and simple way to understand how we could calculate the moments acting at the ankle joint simply from measuring the distance from where our force is pushing on the forefoot, the amount of force we're pushing, and its distance from the line of action of that force to the ankle joint axis. When we start looking at the effects of moments and how it can produce either motion or stability, acceleration or deceleration in the body, we have to go back to Newton's second law of motion so we can understand this very important equation, force equals mass times acceleration, which again is Newton's second law. So what motions can forces have on objects? Well, we can have an object that will be accelerated by a force. In other words, here is a person pushing a shopping cart with very little mass and with big mass. With little mass, the same force will produce a larger acceleration. Bigger mass with the same force will produce a smaller acceleration, but it will accelerate objects in the direction of the applied force. We can also have forces that push backwards on an object to decelerate it. In this case, here is a car that's running into a brick wall, and at the point of impact, the brick wall is going to be pushing opposite the direction of travel of this car to decelerate the car, since it is this force from the wall is acting in the opposite direction to motion. So this is a deceleration force. And we can also have a situation where equal and opposite forces create stability of the object. So here we have an example of a green object on a yellow table. The green object is pulling the mass of it. Mass times gravitational acceleration is creating a force that's pulling downwards. But this is going to be an equal and opposite force to the amount of force the table is pushing upwards on the object. These two forces are exactly equal. They're exactly opposite in direction to each other, and because of such, this produces an equilibrium, both a translational and rotational equilibrium, which is going to stabilize this object. So this is an important concept to understand, that these equilibrium situations that we have in our daily lives and also in our bodies can produce stability. So let's progress on to what a moment can do across an axis of rotation. So a moment can accelerate an object around an axis of rotation, and this is called an angular acceleration. So here's a gentleman who is accelerating his bicycle down his driveway path, and then he decelerates it. And these are going to be called angular accelerations and angular decelerations. So he's pushing on the pedal with his foot. This generates a moment at the pedal, and it's going to then generate a moment on the bicycle and the wheels to propel him forward and accelerate him. And then he uses the brakes, hand brakes, to decelerate the wheels. So here's an example of angular acceleration and angular deceleration. We can also have the axis of rotation stabilized, just as in the other example of the object sitting on the table for forces, is that we have equal and opposite moments acting on either side of an axis of rotation. This can cause stability. So here we have 200 newtons acting over a 3-meter distance, causing a 600 Newton meter counterclockwise moment on the left-hand side of the seesaw. And here we have 200 newtons working across a 3-meter moment arm, causing a clockwise moment of 600 Newton meters. These two exact and equal but counter-opposing rotational forces or moments or torques are causing stability at this seesaw. And this is another application of the force equals mass times acceleration equation from Newton's second law, and how we can apply Newton's law to rotational forces. So when we start looking at all the various motions and activities and weight-bearing activities that us humans perform on a daily basis, how do these moments How are these moments caused and how do they cause motion? Well, first of all, the human body and other animal bodies produce motion by having our central nervous system sending efferent messages to the skeletal muscles, which then cause electrical activity, which is converted into a contractile activity of those muscles on the skeleton that work along with gravity and ground reaction force to produce our human movement activities. In fact, all human movement activities are a combination of the muscle tension forces acting along with the tendon tension forces, fascia, ligaments, and joints to produce our motion. This being said, it must be understood that when we talk about muscle strength, and even when we're measuring muscle strength, we're not just measuring the force of the muscle, we're also measuring the relative moment arm of that muscle to its axis of rotation. So we have to understand that we're actually not measuring muscle force, we're measuring muscle moments at the joint when we do testing or any sort of muscle strength testing clinically or in the laboratory. We also have to understand that just because we see a joint not moving doesn't mean it doesn't have also forces and moments acting across it. So here we have a gentleman who's very well muscled, and he's holding a barbell, what is going to be producing its mass is going to be accelerated by gravity and produce a certain amount of force. But in order for that gentleman to hold his elbow at a fixed flex position, he's going to have his elbow joint flexors creating a tension force. So you can see how this little free body diagram analysis of a dumbbell being held up in a static position by this weightlifter, we can see that just because we see no motion does not also mean that no forces or moments are present. So how do our skeletal muscles create the movements that we perform on a daily basis? As I said earlier, the contractile activities of these muscles generate tension forces, both at the origins and insertion of these muscles. So here we have the biceps pulling upwards, creating an internal elbow flexion moment. And here we have a weight that is creating an external elbow extension moment. Here is the knee joint. Quadriceps is creating an upwards tension in the quadriceps muscle, which is acting on the patella. And here's a patellar tendon pulling downward. And this creates a compression force at the patellofemoral joint, but also creates an internal knee joint extension moment. So these tension force vectors from the muscles are converted into moments internally, and these act across a moment arm to the axis of rotation of that joint is working on to create a moment. So muscles, therefore, to emphasize this, they can either accelerate, they can decelerate a motion, or they can stabilize these rotations that occur at the joints of our body during our daily activities. So specifically in the foot, let's look at some of the moments that can occur in the foot and lower extremity and how they may apply to what we do as podiatrists and foot health providers. So we must understand first that moments can be divided into both external moments and also internal moments. So an example of an external force would be force on the plantar forefoot from ground reaction force acting underneath the forefoot and the hallux. And these external forces are going to cause a external ankle joint dorsiflexion movement because these forces are tending to dorsiflex the ankle. We also have the Achilles tendon tension force causing an internal ankle joint plantar flexion moment that is resisting this external force from ground reaction force acting to cause a dorsiflexion moment. And that is not the only internal force. Achilles tendon force is also going to cause a joint compression force of the tibia being pushed into the talus and the talus being pushed into the tibia. And also this motion is going to be causing tension forces in the plantar fascia and other plantar ligaments, etc. So external moments are caused by external forces, with the main one in the human foot being ground reaction force. Internal moments are going to be caused by all the forces within the body that resist these deforming forces from ground reaction force, including muscle, tendon, ligament tension forces, and joint compression forces. When we look at the subtalar joint, which has been a subject that I have worked on for the past over 30 years, we start to get interesting as far as how this applies to what we do with foot orthoses and treating people that have foot and lower extremity mechanical disorders caused either by excessive pronation or supination of the foot. Here we have my examination technique where I'm pushing upwards with my thumb on the plantar foot to find the subtalar joint axis. If I'm using my thumb as an external force medial to the subtalar joint axis, this is going to cause a subtalar joint supination moment and subtalar joint supination. If I push lateral to the axis with my thumb, this is going to produce a subtalar joint pronation moment. And if I push underneath the axis, we're going to be producing just compression but no rotational moment, which is going to allow us to find the axis. Subtalar joint pronation moment and supination moments therefore can be caused either externally or they can be caused internally. On the lower diagram here shows my model of the lower extremity, including the talar tibial unit, where I've combined the talus and tibia in one unit with its subtalar joint axis. Here's the medial aspect of the foot and lateral aspect of the forefoot with the calcaneus. We can see that if the posterior tibial muscle exerts a tension force pulling upwards on the medial aspect of the foot, this is going to cause an internal subtalar supination moment. And the peroneus brevis muscle, if it pulls upwards on the lateral aspect of the foot, it's going to be causing an internal subtalar joint pronation moment. So the posterior tibial muscle can either accelerate in supination, decelerate pronation, or it can stabilize against an equal and opposite pronation moment. And the peroneus brevis can accelerate pronation, can decelerate supination, and can stabilize against a subtalar joint supination moment. So these are all important concepts to understand when we start talking about motions that occur in the human body, especially the foot and lower extremity, but also stabilizing forces that can occur either from ligaments, tendons, muscles, or the joint surfaces. What are the effects of plantar flexion moments of the ankle joint? And here we have one of my drawings where we have the center of mass, person standing. We have the gastrocnemius soleus muscles attaching to the Achilles tendon on the posterior aspect of the calcaneus, which can cause plantar flexion moments. And we also have the anterior muscle group attaching to the anterior aspect of the foot that can cause an ankle joint dorsiflexion moment. So let's look at ankle joint plantar flexion moments and what type of effects they can have on the ankle and on our body as a whole. So first of all, when we have an ankle joint plantar flexion moment, let's say by gastrocnemius and soleus contractile activity, it can cause an ankle joint plantar flexion acceleration, lifting our body upwards. It can also decelerate ankle joint dorsiflexion moment. In other words, decelerating our ankle joint dorsiflexion as we lower back to the ground in a tiptoe type exercise. And it can also stabilize the ankle joint against ankle joint dorsiflexion moments. So in this case, where we're standing with our center of mass anterior to the ankle joint axis, gravitational acceleration acting on our center of mass is going to be creating a downward pulling force, which is going to also cause a ground reaction force anterior to the ankle joint that is going to cause an external ankle joint dorsiflexion moment. So you can see we need that gastrocnemius soleus muscle to be having contractile activity in it to generate the Achilles tendon tension force pulling upwards on the calcaneus to create that internal ankle joint plantar flexion moment in order to resist that external ankle joint dorsiflexion moment coming from gravitational acceleration acting on our center of mass. Dorsiflexion moments of the ankle joint can cause other effects. Again, the same model, and here we're going to be using our anterior tibial muscle, extensor digitorum longus muscle, extensor lucis longus muscle to produce this dorsiflexion moment. Dorsiflexion moment can accelerate ankle joint dorsiflexion. So here we lean backwards and we go up on our heels to produce this ankle joint dorsiflexion moment, which accelerates into ankle joint dorsiflexion. Then if we lower our foot to the ground, we're going to be then decelerating ankle joint plantar flexion motion. But also, if there's some other ankle joint plantar flexion moment, that ankle joint dorsiflexion moment can stabilize the ankle joint and make it not rotate at all. So these are some examples of both plantar flexion and dorsiflexion moments to demonstrate more clearly how ankle joint plantar flexion and dorsiflexion moments can cause accelerations, decelerations, and stability at our ankle joint during other weight-bearing motions. Finally, when we start using the concept of moments, we can start understanding how certain surgical procedures may be better for some people and not as good for other people, depending on where osteotomies are placed at the first metatarsal for bunion surgery. The two main types of osteotomies we use are the head osteotomy procedures, such as the Reverden procedure or the Austin bunionectomy, or a base wedge osteotomy. And these are wonderful drawings from Josh Gerbert from his textbook in bunion surgery. So when we do a base wedge osteotomy, it has a distinct advantage since it has a longer moment arm to the head of the first metatarsal. We can do larger angular corrections, whereas in the head osteotomy, we can do only smaller corrections of the intermetatarsal angle, which is dependent on the width of the metatarsal neck. Well, this has there's a double-edged sword to this, is that when we start getting to the fixation that is used for these two osteotomies, let's say we use a screw to fixate a head osteotomy. Here is a modified Reverden procedure osteotomy versus a base wedge osteotomy. We can see that in the 5 millimeter moment arm from the ground reaction force vector to the osteotomy is fairly short in this head osteotomy procedure. But in the base wedge osteotomy procedure, the longer moment arm from ground reaction force of 30 millimeters to the osteotomy, in other words, 6 times the length, is going to increase the moment acting across that osteotomy by 6-fold. And so the advantage of the base wedge osteotomy of being able to correct larger intermetatarsal angles is it has a problem in that it is not going to withstand weight-bearing forces immediately after surgery, and these are going to have to be either casted or placed into a non-weight-bearing situation to allow the bone to heal before we can walk them, whereas in this procedure, this modified Reverden procedure can be immediately bear weight following surgery due to the small moment arms and stability of the osteotomy that is performed at the first metatarsal head. So in summary, regarding this concept of moments, which is a rotational force or a torque, we first of all know that it is going to be calculated by the force acting across that axis of rotation and its perpendicular line of action to produce this moment arm, or force times moment arm equals a moment. Again, moments can either accelerate motion in the direction of the motion, it can decelerate motions in the opposite direction, and it can also stabilize motion about an axis of rotation when that moment is acting exactly opposite and exactly the same magnitude as the opposite moment. Again, moments can be external on the foot, and the main external moments acting on the foot are going to be those from ground reaction forces, but they can also be internal, being caused by such forces as muscle forces, tendon forces, ligament forces, joint reaction forces, and even fascial tension forces. These moments from the internal forces in the muscle, ligaments, tendons, and fascia, along with the joint reaction forces or compression forces, along with gravitational acceleration and the external forces that occur from ground reaction force interacting with the plantar foot, are going to be interacting together to allow us to perform all of our weight-bearing activities that we do as humans in our daily activities and sports that we perform on a daily basis. So I hope that this lecture on moments allows you to understand why moments are so critical to our understanding of foot biomechanics and lower extremity biomechanics. And we're going to try to add to this knowledge with further lectures which will help us understand why some treatments work and some treatments don't work, and what best treatments are for our patients who have foot and lower extremity pathologies. I want to thank you very much for your attention, and I hope everyone stays safe. Thank you.